10, 20 years ago.
You would be surprised that
what they wanted to do is
electronic, whatever, it's a cigarette.
That are in the later stage.
I was interested in a lot of little stuff that was going on today, and I have some, obviously I have my own opinions too. I worked in HIV, but that was 40 years ago. And unfortunately, what I'm hearing today is too much the same of what I heard 40 years ago. And I say unfortunately because I keep hearing, I understand LBGT, okay, but why are we labeling? HIV is about behavior. It's not about who you are. And I think that if we're the advocates, we need to advocate that it's about behavior. And maybe we won't be 40 years from now saying the same thing that we're saying now. And as far as tobacco use is concerned, once they get this together, I'll tell you that with the new health care reform, if you're a smoker, it's going to be more expensive for you. So you're going to pay not only more for your cigarettes, but you're going to pay more for your health care. And never mind, and let's face it, it makes sense. I said to my doctor, listen, I'm 100 pounds overweight. Why don't you stop telling me to do this and do that and give me something to help lose weight? You're always telling me exercise. Well, obviously, if I haven't exercised in 40 years, I'm not going to exercise now. You know what he told me? He said, if you stop smoking for 6 months, you'd be in better health than if you lost 100 pounds. I'm like, what? Okay, so I'll stop smoking. Well, I don't know that I'm in better health, but I'm not smoking and I'm not coughing, so that's a good thing. And I also know that I won't have to pay more for my health insurance. Okay, so while they try to get this together, is it good? I hope so, because I didn't bring a hard copy, which I usually do, and I could have read off of. But we're going to talk a little bit about the Affordable Care Act, which some of you may know based on the news as Obamacare. And the important thing that you need to know is that the law says everyone must have health insurance, okay? And it has made it easier for folks to get health insurance, especially poor people. In Arkansas, we have over 500,000 people who are currently uninsured. Now remember, Arkansas has less than 3 million people. So think of that. If you have less than 3 million and 500,000 of them are uninsured. And the other part of it is that most of those people work every single day, 8 hours a day, and still don't have health insurance. They either have 2 part-time jobs, they have minimum wage jobs, their employer is a small employer who doesn't offer health insurance. All of these people have to get insurance. There are a couple of different ways for insurance. There's something new that's called the marketplace. Some of you may have heard called exchanges, the health insurance exchange or the health insurance marketplace. They're kind of interchangeable words. And it's a new way to buy health insurance. Now, since October 1, I know you all have heard on the news about how the Obamacare website has crashed and it's a failure and blah, blah, blah. Well, it's technology. Hey, technology. We have glitches, okay? That happens. Eventually, that gets fixed. And one of the things that I read in something that I was doing today, I think it was Politico came out today and said that in October, 26,000 folks were able to enroll through healthcare.gov. 26,000 is not a whole lot, as we well know, okay? But in November, it was up to 100,000 that got enrolled. So it is getting better, and it's going to keep getting better, okay? And once it's fixed, what you need to know is what it's going to mean for you, okay? Those of you who don't have health insurance, okay? They extended the deadline. If you want to have coverage by January 1st, you must be enrolled by December 23rd, okay? Now, does that mean that on December 23rd, you can go into the website and you can go through the whole process and get enrolled, and now you don't have to worry about it? No. Remember, insurance costs money. So before you're ever insured, you gotta make a payment, okay? Now, the thing is, what I always say to people is don't rule yourself out of something. Don't say, oh, I'm not going to qualify, or go look and say, oh, this is $400 a month, I can't afford this. Well, if in the past, if you went to the website and you saw the price of plans, it didn't include what's called a subsidy. Based on your income, there are subsidies available. In Arkansas, you know, you've heard about Medicaid expansion, everybody? Yes. Okay. In Arkansas, you know, we changed our legislative makeup this year. And so we have our Democratic governor, and we have our Republican House and our Republican Senate. And so, of course, there was a lot of conflict, just like there is in Washington, about what should we pass it, should we not pass it. We don't want big, you know, big government programs. But there's 500,000 folks in Arkansas who are uninsured. So they can't ignore that. Unlike Washington, we were able to come to a compromise. It's known as the Healthcare Independence Act. You'll hear the private option. What it means is that we have expanded our Medicaid program. Now, Medicaid in Arkansas right now, in order to be on Medicaid, you have to have 17% of the federal poverty level as your income. Now, anybody have any idea how much money that means you can make? For a single person, it means $2,000 a year. Okay? Can anybody live on $2,000 a year? Okay. And that's not all. That's not all. You also can't have assets. So you can't own a house. You can own a car, but it's going to be a junk car because it can't be worth more than $2,000. And you have to be disabled for 6 months. Then you can get on Medicaid. That's what our current level was. So now when we raise that to 138% and we eliminate the asset testing, we eliminate the disability, there's half of the people who are currently uninsured are now going to probably be eligible to receive Medicaid. So that could be some of you in this room. 250,000 people is the estimate. Now, some of you may have gotten, if you receive SNAP, because I have to say this, the Department of DHS,
Code in again for the USB.
I can't do it in here, I have to take it out and then put it in.
Okay.
Okay, give me a second, because I don't know it by heart. It's not mine. Okay, what do I do with my piece of paper?
You're actually doing good, Sandra.
There it is.
You're doing fine.
I'm doing fine. You know, I don't like, I like my crutch. Okay. Well, I appreciate that, ladies. And I hope that for those of you who hear me for the first time that you feel the same way. Okay. Now, where was I? Okay. And it should say today's date and the title of the.
No, it's not.
Oh, when you get in there.
It's not reading. I don't see it.
Oh, okay. So where am I?
Medicaid expansion.
Okay. So what DHS did, which I thought was great, they went through their SNAP enrollment and they identified those folks that they thought would be eligible for Medicaid. And they sent them a letter. And they said, it appears that you and family members may be eligible for Medicaid. If you're for health care coverage. If you're interested, just check off, sign your name, and send it back. They sent out 130 some odd letters. They got back 60,000. Do you know, if you've ever done a mail campaign, how incredible that is? Okay? So those people then had an option to go onto the state's website and pick private plans. Because what I was saying about the healthcare independence or the private option, what the state of Arkansas is doing, and right now Arkansas is the only state doing this, they are taking the money that the feds are giving for Medicaid, and instead of putting people on a Medicaid program, they are letting them buy private insurance plans. So that those people will have Blue Cross Blue Shield, Qual Choice, Ambetter, whomever is selling on the marketplace. They will have what's called silver plans. There's different levels of plans, depends on how much the plan pays for your health insurance. So these people, they said, then you can go and you can pick a plan, okay? If they didn't do that, then what DHS has done is auto-assign them. So these people are going to automatically have health insurance. Now, if they don't like the plan that DHS has chosen for them, they will have 30 days to change that, okay? So even though a lot has been talked about how nobody's enrolling, in Arkansas, we're doing pretty good. Now, I can't tell you about the marketplace because, unfortunately, One of the things when I talked about the marketplace and how it's a new way to shop and you can compare plans and shop for your plans and get a subsidy right online, some states are doing that by themselves. You've probably heard, like Massachusetts, of course, has been doing it for a long time. California, New York, they're doing their own. In Arkansas, our legislature decided that we weren't ready to do our own. But we didn't want to give up everything to the federal government. So we're what's called a partnership state. And we retain two functions. We retain plan management function. That means that our commissioner, Jay Bradford, who's the commissioner for the Arkansas Insurance Department, he still has the ability to regulate everything insurance-wide within the state of Arkansas. The other piece that we kept was consumer assistance. And that's what, by the way, that's my title. I'm a consumer assistance specialist. And that means my job is you guys. Okay, and that's to ensure that that I understand what's going on with you, that the information that I relay to you, you understand, and that your best interest is at heart. And if you have a problem with an insurance company, you can go to the insurance department and you can get that resolved. So we've retained that. But what we don't have in Arkansas is we don't have our own portal. So that means that healthcare.gov, that federal portal, we're dependent on that for you to actually do the enrollment. Okay? Now, as I said earlier, it's improved tremendously. Is it perfect yet? You know, no. Sometimes you're going to have a problem. I know the other day I went in, because I like to go, I can't actually go and pick a plan and register, but I can go in and play around and see how it's working. And I went in, and when I got in, it said, it gave a message. Instead of an error message, which it was giving in the beginning, it basically said, listen, we're experiencing a lot of volume right now. Hold on, and we'll put you in the queue, and we'll let you know when to come. Or if you don't want to wait, you can put your email address here, and we'll notify you when you can come back in. I thought, And before I could turn around, it was like 2 minutes, I was in again, and was like, you can continue. So it depends on the time of day you go, how many other people are online at the time, as to how fast or how slow it will be. There's a couple of tips, and well, I'll talk about the in-person assisters later, but there's a couple of tips for if you're doing it yourself, is don't use Internet Explorer. For whatever reason, it doesn't work as well. Use like Google Chrome or Firefox, okay? Clear your cookies, your browser history, so that because those are some little things that cause problems, okay? Now, for those who don't have insurance, I don't know, insurance is really complicated. I have insurance. I can't tell you what all my insurance covers. I get surprised every time something happens. Doctor says you need an MRI, and I go and I think everything is cool, and they say, oh, I need $300 from you. Oh, wasn't planning on that. So, but there's a lot of things. There's co-pays, there's deductibles, there's co-insurance, there's out-of-pocket expenses, there's, your out-of-pocket limits. There's all these different things that, unless you sit and read your policy, and I don't know about you, but my car policy, my homeowners, I ain't read them from page to page. I can't tell you everything that's in them. And I certainly haven't done it with my health insurance. And even if I did it with my health insurance, I probably wouldn't understand half of what's in there. And if you've never had it, I'm sure you have even more problems. So what the Arkansas Insurance Department has done has established what we call an in-person assister guide program. And what that is we have contracted with agencies, and one of the things I want to say is we purposely contracted with agencies that already had an existing relationship with the population. Okay, so we have mental health counsel. Okay, because we know that there are going to be lots of people with mental health issues out there who are going to need insurance. And as the gentleman over here before said, people need to be able to trust who they go to. We have Deidre, who was here, Levi, who was here earlier, is one of our contractors. Joyce is one of our contractors. Linda is one of our contractors. We want to make sure, and we have them all over the state. Okay, the Arkansas Department of Health is one of our biggest contractors. Why? Because they're in every single county in the state. And we want to make sure that everybody has access to information and has access to assistance in filling this out. Not everybody's computer literate. Listen, Bob talked about him being an old man and him being 61. I just celebrated my 65th, okay? So believe me, computers were not like natural to me. I certainly don't know anything about Twitter and those other social media things that y'all use, okay? But all of those folks, everybody, regardless of what your interests are or where you are, you've got to get insurance. And so why would you come to this old lady when you could go to somebody that you know and you trust and understands what you're saying in your language? So we want to make sure that that happens. The other thing is we have these in-person assisters. There's another, and we call them guides, okay, from our standpoint. We also have what's called navigators. And they're the same. The difference is where their funding comes from, okay? But there are navigators, there's in-person assister guides. There's another classification called certified application counselors. And these are folks who are basically in health provider offices, like the community health centers or your regional medical centers, okay? And then there's your traditional way that we used to buy health insurance from an agent and broker. Well, in the state of Arkansas, they passed Act 1439 last year. And 1439 required anybody who was going to assist someone enroll in the marketplace in the state of Arkansas to be licensed by the insurance department, okay? So what we did is we set up a training program, and everybody whether they're an in-person assister guide, a navigator, a certified application counselor, or an agent and broker has to be trained and has to be licensed. Part of the licensing requirement is a criminal background check, and that's a consumer protection piece, okay? Once they have gone through this licensing process, they then can help you. We make sure that everybody gets the same message because we want every one of you, I don't care whether it's an HIV person over here or a mental health person over here or some rural person over here, they should be getting the same message. We do not want people to get different messages. We want them to understand, and we don't make any judgments, okay? We don't make any decisions for consumers. We tell you, here's the plans. We'll ask questions. These in-person assistants will ask you questions like, for instance, I'm diabetic, okay? So I take insulin. So I'm gonna tell an in-person assistant, this is the kind of insulin I take. I need to make sure that whatever plan I pick, that my medications are on that plan, that my doctor that I wanna see, that the hospital I wanna see is on that plan. So these are the kinds of questions that folks are going to ask you in order for you to be able to make the appropriate decision for yourself about which health plan best meets your needs, okay? Now, let me tell you a little bit about the subsidy piece, because I told you that we expanded Medicaid. Well, what does that mean, the private option? So you get this letter. I'll go back to the SNAP recipients who got their letter, and it says you could get this health insurance. Now, depending on your income, if it's under 100% of the federal poverty level, you will not have to pay anything. Your premium will be paid 100% and you will have no cost sharing. If it's between 100 and 138, there may be some cost sharing. So maybe you have to pay $4 when you go to the doctor, okay? Or maybe you have to pay $2 toward your prescription. But essentially, you're getting free health coverage, which is why I say don't ever count yourself out. I'm one of these people. I think I can do whatever I want to do. And until you tell me no, I'm going to do it. Okay? And that's how you have to be. Okay? You have to believe that I'm here until I don't qualify. Okay, now I don't qualify for this, so what do I qualify for? Because even though you may not qualify for the private option, there are subsidies up to 400% of the federal poverty level. Now, to give you an idea of what I'm talking about here, 138% of the federal poverty level for an individual person is about $15,000, and I'm rounding off. It's a little bit more than that. Okay, it's about $15,000. 400% is $45,000. So up to $45,000, a single person can actually get help to pay for their premiums. So why would I say I'm not interested? You know, if you give me $25 towards it, that's $25 I can use for something else. You know, so I think it's really important that everybody at least get the information. If you're computer literate, get online. You know, I mean, I'm a huge Google fan. I Google everything. You know, and Joyce knows I used to work at DFNA, and she was one of my grant recipients at the time. And I've had people that call me up and say, I just called you because you're one of the smartest people I know. And I'm like, I know how to Google. I ain't smart. I just know how to Google. So when you ask me a question that isn't in my preview, I'll go look it up and say, well, blah, 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 blah. And that's what, if you're one of those people who's computer, do that. If you're not, get with Joyce, get with Linda, get with one of the organizations that have trained people and talk to them. And the thing is, you've got to, Bob talked about advocating for yourself. You've got to do that. You've got to be open about what your needs are. I mean, I didn't have to tell y'all I'm 65. I don't have to tell you I'm a diabetic, but I ain't ashamed of it. Heck, I lived 65 years. That's pretty damn good. And yeah, so I have a few issues there, but if you live the life, sometimes there's things you got to pay for. It's like a birthday card I just sent to my girlfriend that said something about the wrinkles. Every wrinkle on your face is your life experience. Well, there's some that we could forget about, but it's okay. Whatever it is that you need. I always go back to when I lived in Florida before I came here, and I had a pastor there who said, "You have not 'cause you ask not." I have taken that as like my mantra. And everybody knows. Sometimes people say, "Sandra, you tell all your business." Well, if I don't tell you I need a plumber, how are you going to tell me, how are you going to recommend one to me? Okay, if I don't tell you I need an electrician or that there's something wrong with this, how are you going to make that, why would you, nobody's going to automatically say those things to you. So I'm one that you put it out there. What you put out in the universe is what you get back, And so I'm for that. Now I'm veering off, but there are obviously some issues with. So I'll give you an example. Let's say you're a family of one, and you make 200% of the federal poverty level. It's about 222,000, and you pick a plan, and let's say that plan costs $5,600 a month. I mean, not a month. A year. Sorry. Yeah. A year. Okay. Now, you've all heard the Affordable Care Act. Well, the affordable in Affordable Care refers to the fact that you should not pay more than 9.5% of your income for your insurance. Okay? Now, that's not 9.5% of what you take home. Because, if we all made what we made instead of what we took home, none of us we'd all be above that 400% of the poverty level. But if that's the affordable. So based on your income, they decide how much of your income you should pay in your premium. So at 200%, it's about 6 or 7%. So 6 or 7% of 22,000 is 1,500, somewhere in there. So that's all you are required to pay. But the insurance that you've picked is $5,600. The difference between that 56 and that 15, that's your subsidy. Okay? So like I said, don't look at the $5,600 and say, "Oh, I can't afford that." Because that may not be what you have to pay. Okay? So it's really important that you get all your facts before you just don't do it. Now, what happens if you don't get insurance? Obviously, it's the law. So if you don't do, what do you think is going to happen? There's a penalty. And what's the best way to penalize any of us? Money. Money. Okay? I mean, that's it. If you speed, you get a ticket, the ticket costs you money. Because that's what we all understand. So there is a penalty if you decide that you are not going to be insured. Okay? Right now, that penalty for 2014 is $95. Or 1% of the adjusted gross income of each adult in the household, and half of that for each child. Okay, not a lot of money. It really, a lot of people are going to say, "Oh, I'll pay the $95." Okay. In 2015, yes.
Will they still get the crazy medical bills like from the emergency
If
room?
you don't have insurance, you're going to get medical bills.
So they're going to have the penalty and the
That's
crazy
right.
emergency bill.
Yeah, well, of course, if you go into the emergency room. And that's the other thing that we all have to understand. Part of the reason that insurance is this high for a lot of different reasons. I won't get into my personal reasons, but emergency room. A lot of times we go to the emergency room, or because we don't have insurance, we wait until we can't wait anymore, and we go to the emergency room. By the time we get there, that tiny little lump that we felt over here is now this big. And now it's metastasized all over the place. And now I have this huge expensive treatment. Whereas if I had gone to the doctor when it was this big, it could have been removed and it could have eliminated a whole lot of expense. So for me, getting insurance is only the first step to health reform. Okay, it's the first step. Get insurance so that you can get health care, because that's what keeps us living and that's what keeps things going. And so anyway, I was going on with the penalty. Okay, so $95, that's what it is for 2014. In 2015, it goes up to $325 and 2% of income for each adult. So it has now doubled, okay, tripled, I'm sorry. Now the next year, 2016, it doubles again and goes to $695. We don't know how high it's going to go. But for many people who are going to choose not to get insurance, they're going to be paying a penalty, getting nothing for it, when in all probability, they could have gotten insurance which was paid for. And not, you understand? So it's really, I work hard for my money, okay? And I mean, I may waste stuff, but when I buy something, I want something in return, okay? So I don't want to just give it away to just be giving it away. So I think that those are the kinds of things we have to think about, and we have to talk to our neighbors and our family, because even though you may be insured in here, you may be sitting next to somebody in church. You may be at the club next to somebody who doesn't have insurance, okay? But if we don't talk about it, and that's one of the things that Bob, and I love Bob, God, I love Bob. Bob actually was on one of my advisory committees and quit. And he quit from my advisory committee only because he is one of these people that if he can't say what he needs to say, he don't need, and that's why he doesn't take any money, okay? So he comes back because he needs to. Hey, it's just like I can't say everything I want to say. I'm on state time right now, okay? And there are some state employees in here, so I can't, but he can, But it's important that we advocate, and that we become, as Joyce used to say, ambassadors. Everybody in here, you get information, you've got to pass that information on. Okay? It is too important. There are too many things going around in terms of our health. And as African Americans, as minorities of any sort, and even if you're not a minority, there's too many folks are dying unnecessarily or are in poor health. I see people walking around, people say, oh, you look good for 65. Yeah, but I'm not exactly as good as I could be. But, oh, okay, yeah. But part of it is understanding and learning how to take better care of ourselves. We've got to do this. We've got to do it because we have children, we have grandchildren, we have nieces, we have nephews. They follow in our footsteps. They do what we do. Okay, the smoking. I mean, that's kids think that is so cool. I mean, and even though the cigarette, the non-tobacco cigarette thing, it's still the same behavior. Okay, so they're not getting the tobacco, but it's still the same behavior. And we have to teach our children. And you can't. I'm sorry, I have a son, old as most of y'all, but I was from the generation of do as I say, not as I do. You can't do that anymore. You can't do that anymore. Now you have to set the example. And, and it's hard if you've not had the example before to follow. But it's really important that we take responsibility for our own actions. Get the information. Healthcare is so important. We're talking insurance, but I only talk insurance because it is the vehicle that gets you to the healthcare. Okay? So let's all get insured. And I'm going to stop. You guys ask me questions. Yes, ma'am.
Okay. I just wait to ask. I got 2 out of my 3 sons that are now finished college. Mm-hmm. They're on their first good job. And I'm telling them, okay, you need to get insurance on your job or you'll get fined. I don't know anything, Jeff, about that. Should I have told them to go
To the marketplace?
Yes.
Okay.
And both of them are single would make about maybe, let's say 25,000.
Okay, here's the deal. If your children are under 26, you can keep your child on your insurance policy until they're 26. You can. But here's the deal with the marketplace. I told you about the subsidies and how you can get help. If you have employer-sponsored insurance, that's affordable. If you're on Medicare or you're on Medicaid or a VA program, you are not eligible for a subsidy on the exchange. So if you have a job, now this is a little bit of a glitch in the whole system. If you have a job, and there are many, like let's say cafeteria workers in school, okay, they're offered insurance. The single insurance, the policy for the employee themselves, it's affordable. But I'm married to a man who has his own business. He doesn't have insurance, okay? In order for me to cover him on this insurance, I now am giving them my whole paycheck. It's unaffordable. He can go to the marketplace and buy insurance, but he can't get a subsidy because the affordable is only for individual coverage. So that's a little bit of a there is a program called a catastrophic plan, and it's for those who are under 30. It's a very low premium, but very high deductibles. So it may be good. See, everybody has to decide which is the best plan for them. If you're a 25-year-old who's relatively healthy, okay, and you only go to the doctor once a year for your annual exam, you might want a plan that, let's say a bronze plan costs $100 a month, but if you go to the doctor, it's $100 a month. So you say, okay, so you pick that. But now the same person at 45, okay, who has diabetes and high blood pressure and goes to 3 or 4 doctors 4 or 5 times a year, has to pay $100 for each one of those visits, plus that may not be the best plan for them. So that's why I say that it's really important when you're talking with one of the in-person assisters that you give them as much detail as possible so that you can make a really good informed decision. So back to your sons, if they are offered affordable health insurance from their employer, they need to take it. All right. There's a gentleman back here who had his hand up first.
Hey, I got a question about this insurance type stuff.
Sure.
This real talk, cause I'm really sick. I'm a diabetic and I take 4 shots a day and I'm on the pill.
Welcome to the club, baby.
I've been trying to get insurance all my life since I've been sick. I've been sick for like 9 years. And they told me I'm not eligible for Medicaid because I don't have any children.
And that has changed. What I said to you before about the 17% and whatnot, you now need to talk to an in-person assister. If your income as a single person is under $15,000, under $15,800, is under that, it doesn't matter whether you have children.
Okay.
Okay.
Here's another question I'm finna say. So I don't file for my disability or whatever. Okay, since I don't file for my disability, cause I get food stamps too. Okay, so when they sent me to the Medicaid for you to apply for Medicaid, they told me that I wasn't eligible for Medicaid because my disability claim is open. So they said that federal overrules state. You get what I'm getting at? So in other words, that disqualified me.
How long ago was this?
It's been since I've been back.
And that is? Like, we know when you left and we know when you came back.
Because I used to live in Arizona. Arizona had this thing that in order for you to get day insurance down there, you have to have kids too. So I've been back here for like, I say 3 months.
Okay, the other, let me tell you this also. Medicaid has residency requirements also. What you need to do is you need to sit down with an in-person assistant and you need to go through the process and you need to find out what, because I can't tell you, I'm not DHS and I can't tell you whether you qualify for Medicaid or not. But I know that for Medicaid, there is a residency requirement. I don't know all the rest of the requirements, but you just have somebody check it out. Don't give up. That's like the worst thing that you can do is don't give up. have somebody work with somebody. If you go to Joyce or you go to Linder and one of their staff is going to work with you, they will work with you through the process. Oh, pre-existing conditions don't matter. Okay? So in the past, if you were a diabetic and you were going to try to get private insurance, not on your job or anything like that, just private insurance, the insurance companies could charge you more, or they could just say, we're not going to insure you. They can't do that anymore. Okay? And that's a big deal because let me tell you, and I don't know if any of you have experienced this or not, but there are people who work every day, and the only reason they work is for insurance. Okay? My last job, a woman came, she had been laid off from a previous job because the plant that she was working in closed, and she was ready to retire, but she couldn't retire because her husband didn't have disability yet, and she had to have insurance. So instead of retiring at the age that she was ready and had the money and could afford to, she had to stay on her job for the insurance. Today, she doesn't have to do that. Okay? You had a question, sir?
I have a couple. First one is like the voice of my customers. I have received several of them with the eligibility status from the government.
I'm sorry. Let me come closer to you because I can't hear you.
I said I have two questions.
Okay.
Several of them, they show me the eligibility, and they are assigned already a plan. Actually, I know the number. And they were interested in changing because that's one of the things that the letter says. And
within 30 days.
That the website, the state website offers. But when you hit change or if you hit grant coverage, either one of them goes nowhere. So they are actually not allowing them to change. And I don't know what to offer them because they are about to run out of the time because they say 30 days and they actually one of them is today. And it didn't.
The only thing I can suggest, because you're absolutely right, what he was talking about is when folks got that letter and they went and they either didn't enroll and they got auto-assigned, and he's saying they got auto-assigned and they didn't like the plan they had, they were given 30 days in which they could change the plan. When he went to the website, he's having issues and problems. The only thing I can suggest is that you call DHS, because they're the ones who run that website. Okay, I'm sorry.
And I said to
Pardon me? It depends on when you enroll. Open enrollment started October 1st. It goes through March 31st. Depending on when you actually enroll in a plan, and like I said, you have until December 23rd to enroll in order for coverage to begin January 1. However, enrolling is not the only thing you need to do. You need to make your first payment by December 31st. Okay, whether that payment, if there is a payment to be made, you need to make it by December 31st in order for the plan to cover you on January 1. Okay? Yes, sir, you had a second.
So the second one is related with that. March 31st is the last day on this open enrollment period. So I'm going to go with quick steps. How many months you have to have no insurance to be planned? 3 months, right?
Right.
That's
Yeah.
January, February, March.
So if you don't enroll by if you enroll on March 31st,
Yeah.
you will not be covered until May 1st, and you will incur some penalty.
Exactly.
It will be prorated. It'll be prorated.
All right. So
Yes.
that's the answer. Thank you.
Okay. Yes, ma'am.
What about people incarcerated?
Incarcerated are not eligible for the subsidy. However, when people come out of prison, okay, and there are some, I talked about how we have these grassroots organizations. We have some organizations that work specifically with the prison population. Because now, if you're going to the drunk tank on the weekend, that's not incarcerated, okay?
You're talking about federal versus
No, yeah, I'm talking. No, it could be state prison.
State also?
But if you're going to prison for 2 or 3 years and it's a state, it doesn't have to be federal. It can be state. You're not. While you're in prison, you don't have. You're not. You don't have to buy the marketplace insurance. Same thing. If you're in jail, okay. Like I said, if you're a weekend drunk tank, doesn't qualify. You know, I don't even know if they do that anymore.
We got time for one more question, and then we're gonna do our drawing.
Okay.
My question is, it's a two-parter. I've heard about enrolling people who do not have insurance. What about people who are currently underinsured, because many are, and they're in a plan, and they're really, maybe perhaps they have a health condition, and that their current insurance does not cover. We know the new plans on the Affordable Care will not have pre-existing condition clauses. So can a person switch if they are underinsured?
Absolutely. Always switch your insurance. All you have to do is not pay your insurance premium and you won't have
It's
insurance.
going in the shop.
So go shop. Yeah.
Okay.
Go shop. I mean, even if you currently have coverage, okay, that you've bought privately, to me, it always makes sense to go and look to see if there's something better out there. If I'm going to spend $50 on a pair of shoes, okay, I'm going to shop for those shoes. I'm going to make sure that I spend very wisely because I might be able to get 2 pairs.
And the second part of my question, Sandra,
Yes, ma'am.
is if you know that you will not qualify for a subsidy because you're not going to be eligible, you should still do
You still may be better off. Okay, and like I said, you just don't know unless you go and explore it. Don't count yourself out. Okay. All right. Well, thank you very much.